Are your menopause and post-menopause clients suffering from aching joints, more injuries, or stiffness? If so, I'm not surprised. Of the 500,000 women who have taken the MyMT Symptoms Quiz, over 80% report joint pain. Many don't understand that this is a symptom of menopause. But here's the thing that you may have noticed too. When women have sore joints and aching muscles, including restless leg syndrome, they aren't able to exercise or do the activities they have loved to do for years. I know myself that this can contribute to weight gain and certainly mental health challenges. That's why it's essential that we, as health and exercise professionals, understand the lifestyle science solutions that are evidence to relieve joint and muscle aches specific to menopause. The science is fascinating. For example, did you know that tendons have estrogen receptors on them, which normally help to keep the tendons flexible? Muscles lose size and density as women move through menopause. This is a normal part of our aging, but when this happens, it affects the way tendons and ligaments work. Collagen turnover is also slower. This means that if women are doing too much high-impact exercise, their recovery is slower and they can build up more inflammation in their joints and muscles. As a woman's healthy aging educator with qualifications in sport and exercise science, my intention is not to replace the advice your clients may be getting from their registered physical therapist or medical physician. Instead, the Menopause and Joint Health course is designed to help you connect the dots between the physiology and lifestyle solutions. In this two-part course, you'll learn about the changes occurring during menopause to joint lubrication, tendon elasticity, and changes occurring with the aging of the myofascia. I will also share with you the changes associated with lymphatic vessels, as well as bone and muscle density and tissue changes. Then, most importantly, you'll discover the powerful lifestyle science solutions that have helped thousands of women on the MyMT programs find freedom in their joints. The exact solutions I use with my clients are waiting for you in this world-class continuing professional development course. I hope you can join me.